Over the last few days, we've seen social media posts and even received a few messages regarding Medicaid, specifically the claim that thousands of Idahoans will lose coverage in the near future. But is that true? Our Andrew Bartline dug in to find out.
At the start of the pandemic in 2020, Congress passed a relief bill that blocks states from ending Medicaid benefits for people who are no longer eligible. In exchange, states received extra Medicaid funding to help with the extra cost. According to the Kaiser Family Foundation, nearly 20 million more Americans enrolled in Medicaid coverage from February 2020 to September 2022. That program expected to end when health officials declared the end of the pandemic. But last month, Congress passed an omnibus spending bill that changes Medicaid enrollment rules. It says states can begin unenrolling people from Medicaid coverage starting April 1st, regardless of if the public health emergency declaration is still in place. This means millions of Americans will likely lose Medicaid coverage because they no longer qualify, and that includes people here in Idaho. During a presentation to the Joint Finance Appropriations Committee on Wednesday, Idaho Health and Welfare Director Dave Jepson explained this to the committee.
We have about roughly 450,000 people on Medicaid. We're one of the very few states that actually continue to do redetermination through the PHE. Most states just stopped altogether. So of those 400,000, we know 300,000 are eligible.
This leaves about 150,000 Idahoans on the chopping block. Jepson says Health and Welfare has not heard from most of these people in 2 years, and some may earn too much income to qualify for Medicaid. Notices will start to go out on February 1st for those who are not eligible. No one will be removed from the program until April 1st, and those removals will continue through September.
And right now, the Idaho Health and Welfare budget is about $4 billion between state and federal funds. Of that entire Medicaid budget, about 60% is going to Medicaid medical costs. And lawmakers are concerned about costs continuing to grow. Some lawmakers calling it unsustainable. Director Jepson, this year, the state has created an incentive for the providers to not go over the allotted costs by putting the costs back on them if they do go over. Though some providers say they're struggling with rising costs themselves, however, Jepson says there are some things they're working on to keep the cost down even more. They plan to announce those measures soon.